Hi guys, this is Dr. Samaliazad. Today we're going to go over some of the structures associated with the renal system. We're going to talk about the kidney and also the smaller structure and the functional unit part of it, which is the nephron, and discover the different parts that are associated with that structure. Now, as you come down here, you can see the kidney here is a bean-shaped structure that has a little bit of indentation in the medial part of it. This indentation is the area where the blood vessels, lymphatic vessels, nerve tissue, and everything else enter, and also is a route for exiting substances, including the ureter. This section is known as the hilum part of the kidney. Now, starting from the superficial part, going all the way deep into the kidney, the first layer that sits on the outside is a layer of the tough supportive tissue known as the renal capsule. From there, you get to the first part, which is known as the cortex part. So this section that is located between these two, considered to be the cortex part. Then from this part, all the way down to this middle, is known as the medulla part of the kidney. The junction between the cortex and the medulla, this junction is known as the juxtamedullary region or zone. As you get there, you can see there are parts of this kidney that the cortex is extend all the way down toward the medial part. These parts are known as the renal column that extends all the way down to that section, and such as in this part, as they go all the way down and sit in this part, this is known as a renal sinus, usually some kind of fat substance located on that part. The other visible structure within the kidney is going to be this triangular structure known as pyramids. The pyramids are the area where you can find the functional unit of the kidney known as nephrons. This is going to be like a base part, and this is the apex part of the pyramid. The apex, or this cone-shaped part, is known as a renal papillae. Renal papillae opens up to this section known as the minor calyx. Then sometimes several of these minor calyxes, they connect together, produce a major calyx, such as the one you can see here. Minor calyx, two of them combine, major calyx, and ultimately gets to the renal pelvis, and from there everything is going to be exiting by way of the ureter toward the outside. Now, the nephron that we just talked about, you can see a nephron in this section here, which the head part, which is this section, is always located in a cortical part. So if you look on this one, you can see all these head parts that are here. These head parts are known as a renal corpuscle. Within the renal corpuscle, I have this intermingling of the blood vessels that you can see here much larger. This is known as the glomerulus. The glomerulus is involved the entrance of this arterial structure known as afferent, and exit from that one is going to be the efferent arterioles. Right alongside of the afferent arterioles, there are this group of cells here known as the macula densa. The function of this structure or muscle is that to apply pressure within the afferent and they are involved in the blood flow and also regulation of the glomerular filtration rate. So let's discover every part of one nephron. Grossly, when you're looking at the nephron, it's going to be composed of the several parts or tubule, which are nothing more than a convoluted one. So if I start, imagine from this one that is here. This is known as the head or the renal capsule. The renal corpuscle. Renal corpuscle composed of two parts. We said glomerulus, and the other structure around it known as the Bowman's capsule. These two together constitute the glomerulus. From there, you will find the first convoluted tubule known as a proximal convoluted tubule, and from there it comes to this U-shaped structure known as the loop of Henle. We have a descending and ascending loop of Henle. It descends all the way to the medulla part and comes back all the way back up to the cortical part. Then After that one, we're going to go to the distal convoluted tubule and ultimately drain everything into the collecting duct, and collecting duct is going to end into the renal papillae, which ultimately releases its content into the minor calyx. Now, this organ, since its job is to cleanse the blood, is highly vascular and composed of different kinds of the vasculature, which ultimately each of them has to produce the afferent and efferent and formation of the glomerulus. So if you look here, we're going to go over the vasculature that comes here. This is a renal artery, which is a branches of the abdominal aorta. Renal artery has an interest to the hilum. Into the alongside of the pelvis is going to divide to the branches. The first branch are known as the segmental arteries. As the segmental arteries will come, again, they branch, they produce interlobar arteries. Interlobar arteries find their way alongside of the renal column and they get to the juxtaglomerular region. Now, when they get this far, known as arcuate arteries. As they come up here, the next branch is known as the cortical radiating artery, or also known as interlobular artery. And interlobular arteries are the one that ultimately, as you can see here, becomes the afferent arterioles, which you can see afferent arterioles is slightly larger than the efferent arterioles. Then from the efferent arterioles, two areas of the circulation or branching is going to be happening. If you look down here, one branch as it comes out alongside here is going to be producing the peritubular arteries. The other branch is going to produce the vasorecta. Vasorecta is the one that goes deep into the medulla and kind of wrap itself alongside of the roof of Henle and regulate some of the electrolyte movement. Then from there we go to the venous producer capillary region here, or network of the capillaries. The first one is going to be known as the interlobular vein, or also known as a cortical radiating vein. From there it will come down right into the arcuates. From the arcuates it's going to go down into the interlobar, as you can see here. This one is the radiating cortical vein, arcuate vein. Arcuate becomes a interlobar vein, interlobar vein becomes a segmental vein becomes a renal vein, and renal vein is going to be draining right into the inferior vena cava. And that's pretty much the stuff that we can see by looking at these models. Now, the next thing that we're going to talk about is that where these stuff are going to be going. Now, looking at this one here, I'm going to show you this model here that is representing when through the ureter things are going to be leaving the kidney and ultimately draining everything to this tank, which is known as the bladder. If you look on the back side, you can see the ureter will come on the back part of the bladder and kind of obliquely enters right into this section. These are the structure that you see. This is a vas deferens, and this one is the seminal vesicles that shows, like in male, the conduction that the urine and also the sperm is going to be happening in the same time. If you open this bladder, you can see in the inside of it that the inner part is composed of the epithelial tissue, which is usually going to be the dome-shaped structure, and also the musculature right here, which is the detrusor muscle capable of expanding. You see this funnel-shaped structure, which is guiding the urine toward the outside, or the urethra, which is going to be sent out. This section is known as a trigon. Trigon, it has two valve or sphincter there. There are valve here, which is known as internal urethral sphincter, and one down in the lower, which is known as external one. The internal one usually opens up, that gives you the sensation of going to bathroom, and external one is the one that you open when you find the proper place to relieve yourself. All right, so that's now we went over the whole structures within the urinary system, and I hope that you find it to be very helpful. Thank you for watching.